Hello, my name is Jacqueline Rodriguez, number 68, and today I will be discussing non-insulin dependent diabetes mellitus. What is diabetes? Diabetes is a metabolic disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. What is insulin? Insulin is a hormone released by the pancreas in response to increased levels of blood sugar in the blood. Type 2 diabetes mellitus is a chronic, lifelong disease that results when the body's insulin does not work effectively. This is called insulin resistance. Here is an illustration of what insulin resistance looks like. The top illustration illustrates normal level of glucose in the blood, and the bottom portion illustrates increased levels of glucose in the blood, which of course is insulin resistance. Some common causes of type 2 diabetes include poor diet, obesity, and lack of physical activity. Other risk factors include family history and genetics, race and ethnicity, high blood pressure, history of gestational diabetes, an HDL cholesterol of less than 35, and a triglyceride level of greater than 250. Some symptoms include fatigue, increased urination, increased thirst, increased appetite, and blurred vision. Other symptoms include nausea, vomiting, weight loss in spite of increased appetite, and frequent infections including those of the bladder, vagina, and skin. Recommended treatments for type 2 diabetes include physical activity, exercising at least 30 minutes, 5 days a week, and doing resistance training at least twice a week to improve blood sugar control. Weight loss, losing at least 5% of body fat can resist in controlling diabetes. And lastly, dietary changes, creating a healthy diet that has a balance of protein, carbohydrates, fats, and fruits and vegetables. Also, limiting simple carbohydrates such as bread is a foundation in controlling diabetes. If recommended treatment does not work, medication is a next step. Medications such as oral sulfonylureas, which assist the pancreas in helping making more insulin, biguanides, which decreases the production of glucose made by the liver, which increases glucose levels in the bloodstream. Number 3, alpha-glucosidase, decreases the absorption of the carbohydrates from the digestive tract, assisting in lowering glucose levels. Number 4, thiazolidinediones increases the cell's response to insulin to work better at the cell site. And lastly, meglitinides, which in response to how much glucose is in the blood, this medication helps the pancreas make more insulin. Diabetic management skills often include learning how to test and to record blood glucose levels, what to eat and when to eat it, how to take medications, of course, if needed, recognizing and treating low and high blood sugar levels, managing sick days, buying diabetes supplies, and properly storing it. Some complications of type 2 diabetes include diabetic coma. Also, diabetes can affect body parts such as the kidneys, heart, feet, and eyes. And anybody experiencing of trembling, weaknesses, confusion, and double vision, a diabetic patient should contact a diabetes healthcare provider immediately. Review questions. Number 1. The hallmark for type 2 diabetes is A. Insulin deficiency, B. Insulin resistance, C. Absence of receptor sites for insulin, or D. Beta cell exhaustion. The answer is B. Insulin resistance. This means that the insulin produced by the pancreas cannot connect with fat and muscle cells to let glucose inside and produce energy. Question number 2. All of the following are symptoms of type 2 diabetes except increased urination, blurred vision, hair loss, and fatigue. The answer is C. Hair loss. Hair loss is not a symptom of type 2 diabetes. Increased urination, increased appetite, increased thirst, fatigue, and blurred vision are all symptoms of type 2 diabetes. Number 3. Which of the following are risk factors for type 2 diabetes? High blood pressure, family history and genetics, history of gestational diabetes, or D, all of the above? The answer is D, all of the above. Other risk factors include race and ethnicity, an HDL cholesterol of less than 35, and a triglyceride level of greater than 250. Number 4. Which of the following ethnic populations are at the highest risk for developing type 2 diabetes? Hispanic American, Native American, Pacific Islanders, or both A and B? The answer is D, both A and B. Hispanic Americans, Native Americans, and African Americans all have high rates of diabetes. Question number 5. Which of the following is a recommended treatment for type 2 diabetes? A. Hanging out with friends. B. Indulging in an immense amount of candy. C. Physical activity. Or D. None of the above. The answer is C. Physical activity. Physical activity, weight loss, and dietary changes are all recommended treatments for type 2 diabetes.